Vanessa Obradovic bringing you a special COVID-19 Certification Inspiration podcast. We appreciate our nurses' dedication to patient care, not only as leaders in their specialty, but in all the roles they are filling during this COVID-19 pandemic. In this podcast, we are sharing some of their stories.
Hi everyone, my name is Hovan and I am an advanced practice registered nurse and an advanced practice CWOCN or Certified Wound Ostomy Incontinence Nurse. I am also board certified in gerontological nursing. I have been an advanced practice CWOCN since 2016 and have been practicing in wound care since 2013. I have been an RN since 2008 and more recently an APRN since 2013. I work at the VA Northeast Ohio Healthcare System in Cleveland, Ohio as an APRN in wound care. The COVID-19 pandemic has changed and expanded a lot of our roles in healthcare. Where I work, we are presently transitioning to a lot of telehealth appointments, video visits, and using our hospital-approved wound cameras to photograph wounds at the bedside. We are still practicing in our current roles, but the roles have changed. Many of my visits are no longer face-to-face. I am triaging patients more from other services and assisting with more lower extremity and vascular wounds. If our presence at the bedside will make a difference in the outcome for the patient, we certainly still do bedside visits as well. We have really come together as a team and are all helping one another in any way that we can, whether it be screenings, getting telehealth up and running, or coordinating care with other services. I feel that my organization really exemplifies the concept that we are all in this together. Some of the most important work I feel I've been doing might actually seem silly, but it is making more routine follow-up calls to my challenging wound ostomy or fistula patients in the home. Talking to them on the phone and or using video visits often helps to keep them out of the hospital and lets them know they're supported and that their CWOCN is only a phone call away. Lots of times, small problems can be remedied over the phone or supplies sent out to the patient in the mail to avoid a trip to the hospital, especially during a time like this when most of Ohio is shut down and everyone is wearing face masks. A challenging moment for me is not being able to see my patients as often face-to-face. Much like most of the CWOCNs I know, our role centers a lot around the therapeutic relationships we form with patients. Watching that challenging wound heal, assisting them to independence with ostomy care, improving quality of life by using a bowel or bladder retraining program, these are all examples of how we enable our patients' independence and get them back to health. We laugh together, we sometimes cry together, and we always support one another. Losing the personal communication in many of the face-to-face visits has been challenging for me overall. I do know that limiting my face-to-face contact and increasing video visits and telehealth helps to protect my patients, especially given the vulnerable population of older adults that I primarily care for. Something that has inspired me during this pandemic is seeing so many different people come together, want to help one another, and support their peers. Seeing the nurses at the bedside help one another, watching the different services collaborate, and admiring the nurse leaders in hospital administration and leadership as they guide us through this pandemic has really been inspiring to me. This has also really opened up my eyes to simple things that I've taken for granted in healthcare and in life, and has really changed my appreciation for so much, as I am sure it has for many of you. In closing, we are in this together. Support one another. Do your best. Also, always be sure to smile, even with your mask on. It shows in your eyes.
Hello, my name is Jessica Simmons, and I'm a nurse practitioner certified in wound and ostomy nursing at Swedish American Hospital Wound Care and Hyperbaric Clinics in Rockford, Illinois. I want to share with you some of my experiences with the COVID-19 pandemic. Our department sees patients in the clinical and hospital settings. I'm also one of the supervising providers for our hyperbaric oxygen therapy. One of the first changes we've made was to start triaging our patients and determine who needed to be seen in the clinic and who we could keep safe in their homes while providing the support they need. Our staffing and census has changed significantly along with workflow changes, and we find we're doing more of our work over the telephone. In fact, that has been a big message we give to our patients, is that we are only a phone call away if they need anything. We are staying very busy, however, we notice it's a very different type of a busy. In the meantime, much of our nursing staff has been training to work in the hospital at bedside if needed to provide any additional support to each of the units. The other APNs and I continue our coverage at the clinic, hospital, and hyperbaric oxygen therapy, and we're now getting set up to start doing telehealth visits. While many other departments in our facility have closed, we have stayed open, and this is mainly to try to keep our patients out of the emergency room. Keeping our patients out of the emergency department has been more important now than ever. Like many other healthcare providers, I've gone through a range of emotions from this whole COVID-19 pandemic, ranging from fear of the unknown and possibility of being infected, to increased stress from what seems to be endless emails and constant policy changes, to being impressed and proud of how we all can pull together and get things accomplished in such a short time. I'm going to continue to go to work and take care of my patients because that's what I do as a certified woundostomy nurse. I thank you for taking the few moments to listen to my experiences, and perhaps you may be reflecting and noticing that many of your experiences are similar to mine. Thank you.
My name is Sarah Erslev, and I'm a certified wound, ostomy, continence, and foot care nurse. I've been certified in the wound, ostomy, and continence since 2013, and then I got the foot care certification in 2017. I currently work for Children's Hospital Colorado, which is located in Aurora, Colorado, and I live in Golden, Colorado. At Children's Hospital, we're faced with different challenges, I think, during the COVID-19 outbreak. Since children aren't typically being impacted as greatly health-wise by the virus, we are supporting the surrounding adult facilities by increasing the age of patients that we're willing to admit with other sicknesses up to age 30. So the wound team kind of has our normal patient load that we're kind of used to seeing this time of year. And then in addition to that, we're being asked to do some more administrative type things with policies, updating some, implementing the Braden scale to be able to take care for those adult patients that we're not used to doing. So doing the education and updating the policies and that kind of thing. We also created a tip sheet for the staff, how to take care of their own skin while they're wearing this PPE more continually than they're used to. The challenging moments, I think, for me are just, feeling kind of lucky that I have a job I can still do, but then knowing that so many people aren't in that position, and I feel bad for them, and I wish there was more I could do for them. Also, it's hard to balance that I'm here, I'm helping everyone else, my kids are home, having to do schoolwork at home, and it's hard to balance all of that emotionally and mentally and physically. It's just kind of a lot, and I realize everyone's going through it, so we're all just doing the best we can. And I think that's what really inspires me, is just seeing how many people are doing the best they can and how communities are feeling a lot smaller than they did before all of this. And just we're actually kind of connecting more with some of our friends who we don't see that often anyway. But because of this, we're so desperate for that connection to other people that we're having these FaceTime, Google Hangouts, or Zoom meetings with friends who we wouldn't maybe do that with otherwise. So that's kind of more on the personal level, but work-wise, it is inspiring to just see how many people volunteer to come in and do the employee screenings, and who's willing to just show up wherever they're needed and do whatever they can to help their community during this time. Thanks.
Hello, I'm Jonathan Smith. I am an RN case manager, and I am a certified foot care nurse. I have been for about 10 years, and I'm a board member of the Wound Ostomy Continence Nursing Certification Board. I'm an officer in the United States Public Health Service, and I work for the Indian Health Service in Anchorage, Alaska, at the Alaska Native Medical Center. Prior to the pandemic, I did case management as well as training and supervision of our foot care clinic that serviced our primary care clinics here in Anchorage. We had 8 primary care clinics. Since the pandemic, we have closed all but 2 of our clinics and turned one of them into a respiratory clinic. Like I said, we have temporarily closed the foot care clinic altogether for now. I'm doing case management from home, making sure people in the bush are taken care of and brought in if they need to be brought in, but trying to do that from home, as well as we're alternating shifts at the clinics that are open at the hospital. So there's been a lot of change. I've also been working shifts at the doing nasopharyngeal swabs at the drive-through testing site here in Anchorage. Alaska certainly hasn't been hit as hard as many other parts of the country, but we're bracing for the worst and hoping for the best. As of today, Monday, April 13th, there have been 277 confirmed cases of COVID. 31 people have been hospitalized and 8 have died. I think everyone in healthcare has had to be incredibly flexible and adaptable during this pandemic. It's a constantly changing time in healthcare. It's requiring all of us to be flexible and to work out of our comfort zones. And I truly have to say I've never been prouder of the people I work with in healthcare and just healthcare in general in our country. I think we're pulling together and in a heroic fashion. I'm proud of the profession I work in. I wish you all the best. Keep your head down, stay healthy, and keep doing what you're doing.
My name is Dr. Cathy Wogamon. I serve the veteran population at the Lake City and Malcolm Randall VA hospitals in the wound and ostomy outpatient clinics in North Florida. I'm wound, ostomy, and foot care certified, and I serve on the board of directors of the WOCNCB. The COVID-19 outbreak has changed our protocol at the VAs as we strive to protect our veteran population. Along with daily employee screenings, we have prohibited visitation from the public, not only to our CLC, which is the nursing home residents, but also to the hospital. The wound and ostomy clinics have remained open for those who are medically necessary and desire to be seen, and we have continued telehealth visits with the same protocol. My dad always taught me to glean something positive from every experience in life, whether that experience was good or bad. One positive that I have gleaned from the COVID-19 experience is the recognition of the nursing profession. We all know in nursing that what we do is not a one-time thing. It's a daily process of serving where, when, and how we are needed. A dedication that rises above our fears, and sacrificing at times of family time and other commitments to rise to our call of duty as healthcare professionals. I want to personally thank each and every one of you for what you do every day for our patients. Thank you for going the extra mile to become certified as wound, ostomy, continence, foot care, and WTA specialist. It is your dedication and commitment that will carry the torch of these specialties not only through this season of pandemic, but every day as you serve our patients. Thank you.
providers and essential workers who are providing care and must-needed services during this COVID-19 pandemic. Thank you. Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.